Now, in this lecture, we are going to discuss the subject, which is spread of dental infection in the soft tissues. Before I start discussing the spread of the infection in the soft tissue, I would like to mention something we discussed previously in the lecture of odontogenic infection of the jaws. As I mentioned in the previous lecture, that the periapical abscess confined to the apical region of the tooth or of the root, or sometimes confined to the lateral side of the root as it is associated with the accessory canals. But in both cases, whether in the lateral side or the apical side, the periapical abscess is still confined, or the infection still confined within the jaw, within the maxilla or the mandible. In this lecture, we are going to discuss the spread of the infection from the bone, case of the upper or the lower jaw, to the soft tissue surrounding the jaw. How does this infection spread to the soft tissue of the soft tissue surrounding the jaws? In this diagram, we can see that the periapical infection here spread to the area of least resistance, which is the cancellous point. Then after, it goes to erode the labial plate and then spread to the soft tissue surrounding the jaws. So here, the periapical infection spread to the soft tissue surrounding the jaw. The infection could spread not just in the labial side, but also could be spread in the palatal side as well. This is depend on many factors which we are going to discuss in this lecture as well. Spread forms of dental infection. The infection may take one of the following forms during spread of the infection. Either in the form of cellulitis, which is spread of the infection in the loose connective tissue, or abscess, which is cavity filled with pus, or in the form of gangrene, which is not it is very rarely seen nowadays because of the establishment of antibiotics. The main differences between cellulitis, in this case, or in this image, we can see this patient has cellulitis, and in this image, the patient has abscess. So what is the difference between cellulitis and abscess? Both of which, these are spread of the infection in the form of cellulitis or abscess. Cellulitis is considered as acute type infection because it occurs within few hours or a few days, 1 or 2 days, while abscess is considered as a chronic infection because it takes longer time. In case of the cellulitis, the swelling is larger than that of the abscess. The abscess is small, while here is larger. The swelling of cellulitis is diffuse. We can see that the swelling diffused and the border is ill-defined, while here, in case of abscess, the swelling is localized with well-demarcated borders. The consistency of the swelling in case of cellulitis is usually hard or indurated, while in case of abscess it is usually fluctuant because it contains pus. Here also, in case of cellulitis, since it's acute, so it is usually presented clinically with severe pain, and in case of abscess, usually presented clinically with mild to moderate pain as well. The type of bacteria that establishes the cellulitis usually is aerobic bacteria, while in case of the abscess, the bacteria usually either anaerobic or mixed type bacteria. The treatment of both conditions also is different. In case of cellulitis, the treatment usually requires a course of antibiotics, while in case of abscess, usually it requires incision and drainage to evacuate the pus. So this is the main differences between cellulitis and abscess. Here we can see that the abscess could be seen in the labial vestibule or even in the palatal vestibule. It could be seen also extraorally in the skin and the peroral region. Sometimes, if the abscess is not treated and the immunity is good of the patient, or if the patient taking antibiotic, in this case, the abscess will be burst off spontaneously, and this is lead to drainage of pus. This is pus drained not due to incision, flat incision, but due to the abscess burst by itself and leading to the formation of what we called sinus tracts. So sinus tracts could be seen intraorally or even in the skin extraorally as well. Factors determining spread of infection. This is including the general status of the patient, whether the patient has any medical condition or not, immunity of the patient, such as patient with diabetes mellitus. This patient has low immunity, and patient with alcoholic, or patient taking corticosteroid, or even malnourished patient. All those patients usually with low immunity, and they may facilitate the spread of the infection. Virulence of the microorganisms. The high virulence of the microorganisms, the high possibility of the spread of the infection to the surrounding soft tissue of the jaw. Abscess drain or not. Since abscess contains pus, and pus contains bacteria and toxins, so drainage of the bacteria and their toxins, this will lead to the resolution of the condition as quick as possible. Now, anatomical factors controlling the spread of infection. Source of the infection, whether the source of infection from the upper jaw or from the lower. Even sometimes it's very difficult to differentiate between the swelling, whether from the upper jaw or from the lower jaw, especially in case of involvement of the buccal space, which will be discussed in the later in the future when we discuss the spread of the infection to the facial spaces. The point at which the infection occurs, for example, if it is labiobuccal or palatolical. If we can see here, this is the central incisor. The labial plate here, it's thinnest than that of the palatal plate. So the erosion of this part is very easy, so the spread will be labial. While here, for example, in case of lateral incisor, since the root inclined palatally, so the palatal plate is thinnest than that of the labial plate. So erosion of this plate is very easy, and the spread of the infection to the palatal side. Here also there is another anatomical factor, which is the attachment of the muscle. If the muscle attachments above the root of the tooth, of the infected tooth, and if the infection below the muscle attachment, so the infection usually can be seen in the labial vestibule, intraorally in the labial vestibule. While if the infection above the muscle attachments, so in this case the spread of the infection will be seen in the soft tissue surrounding the jaw. Here we can see that the infection below the muscle attachment and infection spread to the labial vestibule, as can be seen here clinically. The route by which dental infection spread. There are three routes, either by direct continuity from one tissue to another tissue, as in case of a condition or serious condition called Ludwig's angina, or through blood vessels, what we call hematogenous spread. This is the spread of the bacteria in the blood. So this may lead to bacteremia or septicemia or pyemia, and also it may lead to serious conditions such as a condition called cavernous sinus thrombophlebitis. Through lymphatics, the involvement of the lymph node, the infection usually spreads to the lymph node, and if the infection beyond the capacity of the lymph node, the infection may spread to the surrounding soft tissue. So this is the end of the lecture, and thank you for your attention.